If pre-existing conditions are back in play, I'll never get health insurance. If lifetime caps, it would bankrupt our family or make me feel like I don't have a right to live. So there will be deaths.
Since I'm legally blind, I won't get any health care. Sorry.
The reason why we're out here today is we're just going to talk to the senator's staff about how terrible this health care bill is and how it's going to affect Iowans. A lot of rural hospitals are going to be affected, especially with the Medicaid cuts. A lot of rural hospitals rely on Medicaid. We already have a Medicaid disaster in our state with Medicaid privatization. How many other folks do you see out here today that are in support of this bill? Not many folks support it. Not many folks are willing to come out here on a weekday. Bad for Iowa. It doesn't represent Iowa values, so the senators should know that. I don't think they've been hearing too many optimistic calls.
All right, so we're here today at the federal building to visit Senators Ernst and Grassley's offices around the health care issue. Folks have sent in emails, they've made phone calls, but we felt it was very important to physically bring folks here, share their stories with the staffers, and have them relay that message to both Senator Ernst and Grassley because this is such an important issue.
If pre-existing conditions can keep me from getting health insurance, I'm never going to get it. I could also be in trouble on the lifetime cap. I don't think that health costs should bankrupt our family, but it sure could.
Would you like me to get your name and contact information? So
we're here today. All of us are really concerned with the health care bill, so get your pen and paper ready.
I think the expansion of Medicaid has just been terrific in this country. And the bills that have come out of the Senate and the House really, really endanger that. We got a lot of vulnerable people in the state of Iowa that are going to be negatively affected by that. And there are many reasons that I think Senator Ernst should vote against this bill, but that's a huge one.
Block granting Medicaid is a really terrible idea. That essentially limits and then begins to lower the availability of funds when there's no ceiling or limit on people's needs. People's needs don't go away when you take away the resources.
And so institutions to care for mentally ill people, institutions for prison reform, all those things kind of get cut so that the wealthy can have a tax break. It's just so immoral to me that the poor always suffer at the hands of the million and billionaires in our country.
To me, it means this is tax refund for the people who do not need it. It's taking away essential benefits for some of the most vulnerable people in our society. To me, it means that they have lost their moral compass.
I come today as a constituent with 3 college degrees, and I work 20 hours a week at a program that puts mentally ill people back to work. And I am mentally ill, and if this bill gets passed, it'll take away my health care, my housing, and the medication that I have to take to go to work. And that's all I want to say.
If pre-existing conditions are back in play, I'll never get health insurance. If lifetime caps, it would bankrupt our family or make me feel like I don't have a right to live. So there will be deaths.
People lose homes because they can't pay for health care.
I'm a 30-something woman. All of my friends are having children. I would like to be able to have a family. And if my insurance company can choose not to cover maternity coverage, that puts my being able to start a family in jeopardy. And with decreased access to birth control, women who become pregnant accidentally could find themselves facing bankruptcy by not being able to pay for their maternal care.
I will have health coverage, but I bet the premiums will go through the roof. And all those Republican people in Aggie that voted for her, their premiums will go through the roof. So if nothing else, if she's just looking at politics, she better think about that. But as a woman, I'm concerned that 13 men drafted this thing. And where was Senator Ernst in there
right.
squealing, saying, why don't the girls get to come in? That's just unconscionable.
More than 500,000 veterans benefited who don't get health care through the VA. So they get that through the Medicaid expansion. So if we roll that back, there are going to be 500,000 veterans, without health care.
I'm very concerned about Medicaid and how that would affect children. Somewhere close to 30 million children across the United States. I know that Ankeny Community Schools bills Medicaid. I know that Des Moines Community Schools bills Medicaid. So if Senator Ernst has a heart for children, I believe she'll vote against this bill.
Since I'm legally blind, I won't get any health care. Sorry.
But we're also going to come back here on Wednesday, as they mentioned, from 4 to 5. So that's the final day. We need to make sure we show up and put a lot of pressure on them.
But it always makes a difference when people speak up, and it's about taking as much action as you can, physically, in person, or, online. Doesn't matter. Voices need to be heard because lives are on the line.